St. Peter's Health Partners held that virtual public forum to explain why it concluded that closing the Burdett Birth Center is necessary and laid out the plan to mitigate negative outcomes. St. Peter's has maintained it will continue to provide 100% of services to 100% of patients. The only change is the location of births. But the idea of moving what happens at Burdett to St. Peter's is something that does not sit right with midwife Tisha Graham, who says both places have vastly different cultures.
Midwives have a different model of care that relies more on normal physiological birthing processes and supporting people through that process, as opposed to relying first and foremost on medical or technological interventions.
In addition to concerns over the quality of care, transportation remains one of the major worries. On Thursday, St. Peter's explained a voucher program would be used for transportation, but Graham and Assemblyman John McDonald were left wondering how that process would work.
You know, I don't know if Uber drivers today or shuttle drivers today or CDTA folks today are really excited about being involved in the labor and delivery process.
The Save Burdett Birth Center Coalition issued a statement after the forum calling on the state health department to reject any closure plan that has not been reviewed by the community and does not thoroughly and convincingly address the many challenges identified by St. Peter's Health Partners' own health equity impact statement. McDonald wants any future forums to be in person.
I've been very clear this should not qualify as their required hearing for the closure, although they did indicate last night that they could consider this to be. I disagree strongly with that.
Reporting in Troy, Karina Dominguez, News 10 ABC.
Now, St. Peter's is hoping, they say, to close the birth center by the end of June of next year.
But that will not happen until the state health department approves the application. And so far, the department says that the closure plan has not been submitted.